Scratch that itch or stop it. We're going to talk about pruritus or itching. There's very little else that can cause one to go a bit crazy than an itch that needs to be scratched. Pruritus or itching occurs for all of us, but in our hospice patients, there may be many underlying diseases on top of the terminal diagnosis they came to hospice with that can cause pruritus or itching. As we explore this symptom, you will see how very difficult it is to pin down, and that treatments can be both quite general and then specific, depending on the varied underlying diagnoses they have. Itching may be triggered by many, many different pathological mechanisms, but no matter what the underlying cause, it can cause just considerable discomfort and really affect the patient's quality of life. It can keep one from being able to relax, to not being able to allow restful sleep. It can cause anxiety, frustration, irritability, and even depression if you have it for very long. Itching or pruritus, unfortunately, is still not fully understood, and there is no one treatment or medication that's fully effective. In this first video, we're going to talk about general itching or general pruritus. It isn't necessarily related to a specific disease, such as renal or liver disease. Since many of our patients are elderly, whether they're on hospice or not, it's really important to understand that just simple aging can cause itching due to the thinning of the upper skin layer. As the skin ages and thins, and we've seen how fragile it can be, it can't protect itself as efficiently from bacteria it comes in contact with, even dust mites that are in clothing or bedding, and this can cause itching. If we stop right here, the research says that just over half of the problems with itching start with very, very dry skin. So let's get this addressed first. Here are the very best and simplest ideas from dermatologists. You probably know them all. The most obvious is to increase the water or fluid intake. But this can be difficult in our hospice patients who have lost interest in fluids or they're already experiencing some dysphagia. So do the best in offering as close to normal fluid intake as possible. Secondly, avoid situations that you know cause you to itch, like don't wear wool or don't keep the room overly hot. Perhaps the very most important step is to just moisturize daily. Apply hypoallergenic and fragrance-free moisturizers. The goal is to keep the skin supple so there are no cracks or signs of flaking. Do try this a couple times a week. Bathe first in a tepid bath for about 20 minutes or shower for 5 minutes, or if you're caring for a bed-bound hospice patient, give them a bath, and then very liberally apply lotion to keep all that fluid on the skin and inside. If the scalp is identified as the main source of itching, get a medicated shampoo. Do use a humidifier. This may provide some improvement, especially in the winter when our homes are so dry. And again, that's something to put in the patient's room. So the next thing to do is avoid scratching. How do you do that? Well, the best thing to do is use the palm of the hand if possible. Make sure the nails are they're filed and short, and so that they don't damage the skin as you're itching. And some of your patients, you may have to put on mittens or gloves to avoid their scratching, especially during sleep when they can be just fully unconscious of what they're doing. Did you know that anxiety can actually increase itching? So you may have to look at some underlying worries or anxiety. If the itching is chronic and anxiety or depression are associated, sometimes antidepressants can be prescribed, such as Prozac or Zoloft. This may be helpful in easing some of the types of long-term itch, but they take 4 to 8 weeks to get to their full effectiveness. Your hospice social worker can help you explore that anxiety and may recommend meditation or counseling. Okay, let's say you've done all of the really simple stuff and the itching has continued. In the next video, we will go into some deeper assessment and treatment for pruritus specific to the diseases. In the meantime, don't forget to get our booklet. It has all this good information on how to manage a patient's symptoms, individualize the care plan, watch more of our videos. We're at YouTube, the Hospice Care Plan. And remember, our motto is care is treatment.